Before we turn to tonight's discussion, I would like to share a poem by this great Irish woman, Pam Ayres. And the name of the poem is, Oh, I Wish I'd Looked After Me Teeth. Oh, I wish I had looked after me teeth and spotted the perils beneath, all the toffees I chewed and the sweet sticky food. Oh, I wish I'd looked after me teeth. I wish I'd been that much more willin' when I had more tooth there than fillin' to pass up gobstoppers from respect to me choppers and to buy something else with me chillins. When I think of the lollies I licked and the licorice also I picked, sorbet dabs, big and little, all that hard peanut brittle, my conscience gets horribly pricked. My mother, she told me no end, if you got a tooth, you got a friend. I was young then and careless. My toothbrush was hairless. I never had much time to spend. Oh, I showed them the toothpaste all right. I flashed it about late at night, but up and down brushing and poking and fussing didn't seem worth the time. I could bite. If I'd known I was paving the way to cavities, caps, and decay, the murders of fillings, injections, and drillings, I'd have thrown all me sorbet away. So I lay in the old dentist's chair, and I gaze up his nose in despair, and his drill it do whine in these molars of mine. 2 amalgams, he'll say, for in there. How I laughed at my mother's false teeth as they foamed in the waters beneath. But now comes the reckoning. It's me they are beckoning. Oh, I wish I'd looked after me teeth. Well, good evening, Nashville. Dentistry is the topic for tonight's discussion. According to the World Health Organization, WHO, dentistry is the branch of the art and science of healing concerned with the region, its associated structures, and the hard and soft tissues of the mouth. Dentistry is one of the oldest of the healing arts and one of the most modern of the healing sciences. There are 8 specialties recognized by the American Dental Association. One of those specialties is the orthodontist, and tonight's guest is an orthodontist. Tonight we will be discussing oral health and general well-being and how the mouth is the gateway to general health. Tonight we have, as our guest, Dr. Elijah R. Richardson. He got his DDS from Meharry Medical College in 1955. He got his master's degree and completed residency in orthodontics at the University of Illinois, the Medical Center in Chicago. He obtained his PhD in Human Growth and Development from the University of Michigan in Ann Arbor, Michigan. Dr. Richardson was a faculty member at Meharry for many years, where he rose to a full tenured professor, the chairman of the Department of Orthodontics, and eventually the dean of that dental school. He has published extensively and has presented papers all over the world. In 1981, he was named by Ebony as being one of the 100 most influential African Americans in the United States. Dr. Richardson will be interviewed tonight by our host, Mrs. Erica Battle.
Dr. Richardson, thank you so much for being on the program this evening, but I must ask, what type of dentist are you?
Well, I'm an orthodontist. That's a dentist who specializes in, most people think of it as the alignment of teeth.
Braces?
Braces, yes.
Okay, so I just recently had a guest on, and he talked about Invisalign. Do you use Invisalign, or do you just use the traditional braces? What's your technique? Well,
I don't do much work in the Invisalign area. I use it occasionally, but most of my treatment is done with what was introduced as the latest and greatest, which is commonly called the edgewise approach, the multi-banded approach.
The multi-banded approach.
Yes.
Explain that to me. I'm familiar with that.
Well, it is an approach where you use either bands or brackets in order to attach all of the teeth, and you're able to move teeth individually or move them collectively in order to try to put them in the position where they should be. The teeth, nature did a fantastic job in constructing the teeth, because those teeth are there's a bony socket, and the teeth are hung from that bony socket by a ligament which surrounds the root of the tooth, and that ligament is sensitive enough where I can take ounces of force and move the teeth around, but still it is powerful enough wherein the teeth can put more force. I think most people have figured that 150 to 200 pounds per square inch of force on the tooth, and the teeth remain in place.
Wow, I never knew that.
And so that ligament it's a very sophisticated ligament. Okay, the ossicles of the ear are formed as part of the jaw of the mandible, and embryologically, and they just drift into the inner ear, which gives you a natural connection of the oral cavity to the inner ear, which is so important in our balance when we stand up and also in hearing.
So what you're saying is the mouth is basically the gateway to the rest of the body. But what I also heard you mention was how so many things are connected from your head down, including your heart. So how does heart disease function go hand with periodontal disease? Or for those of us that don't know exactly what periodontal disease that is the disease of the gums.
Yes, there's an extensive literature on that particular problem. Quite a bit of research has been done, and what you do find out is a very strong connection between heart problems and the state of your gums. As we know, the heart forms right in the under the lower jaw, and then it migrates down to the mediastinum in the upper part of the chest. Well, when it goes there, it certainly takes that vagus nerve down, and also the blood vessels, and they are the fascial sheets that go down with the heart, leaves an open pathway for bacteria that might be in the gums or your gingival crest to flow down to the heart and allows the bacteria to infect either the aorta of the heart or some of the valves of the heart, and vice versa.
I've never known that. As many times as I've gone to the dentist and have had my teeth cleaned and just being told to make sure that you do A, B, or C, floss, brush, and rinse, I never knew that I was really not only protecting my mouth, but I was also protecting, oh my goodness, I was also protecting my heart. Go, Erica. Yes. I never knew that. So what would you say to those persons who feel like, well, I really don't need to go to the dentist. I go get my physicals, every quarter like I'm asked to by my doctor, but they have neglected their oral health. What would you say to those persons to really, to let them know you really need to go to the dentist?
Well, it is very important, because nature set things up so that the mouth is the first barrier against the entry of organisms that should not come into the body. And if you don't go to the dentist, and if you don't keep that mucosa intact, then you break down the barriers that keep bacteria and viruses and rickettsia and everything else from going down into the body. If you have that barrier in place, then the mucosa of the mouth, along with the antibacterial activity of the saliva, you are able to keep those bacteria from going down and attacking some of the other vital organs in the body.
Okay. Now, in plain language, the mucosa, you referred to that a couple of times. What is that?
Well, that's the mucosa. That's the skin inside the mouth.
Okay.
Right, including your gums.
Okay.
Right,
So the mucosa as well as the saliva has some type of antibacterial fighting agents?
Yeah, saliva does have antibacterial activity, and it does a fantastic job in helping to eliminate some substances that would attack the body because it will not let them get in.
Okay, so what about those persons who do not take care of their teeth? They don't brush regularly. They do have cavities within their mouth, and it is painful, but you know, of course, they feel like, which pain should I endure more? The pain of the cavities, or do I feel like really going to the dentist and having this shot in my mouth? Not only do the cavities hurt them, but how does that affect their eating habits?
Well, most of your foods that you should be eating need to be chewed, and the mouth was set up in order to initiate digestion, because it grinds up the food and then it mixes the food up with saliva, and the saliva has some enzymes in it that particularly start to breaking down the carbohydrates. And if you don't have your mouth in condition where you will chew, then persons have a tendency to eat foods where you basically put it in the mouth, roll it around with your tongue and swallow it. And of course, when you do that, most time you end up taking on too many of your sweets, too many calories, and the body takes on more than it can burn up in order to maintain equilibrium, so the person starts to become overweight or fat.
So you're saying that, I hate to admit it, but I ate a honey bun for breakfast this morning, but that's not my normal breakfast. Now, you're not talking about the person who occasionally partakes in those type of snacks, but you're talking about the person who, instead of, because that's not my normal breakfast, normally I would eat something like a parfait and some oatmeal with some fruit in it. So you're saying that the person who has something going on with their mouth, granola might not be the snack of choice, because you really have to chew granola, and it might hurt their mouth. But not only that, when we talk about, because the first thing I thought about when you said that was broccoli, one of my favorite vegetables. But unless you cook broccoli too long, it's supposed to be kind of crunchy to maintain those nutrients. So the person who is having trouble with their mouth, they might not want to partake in the broccoli. You're saying that they would rather eat something like French fries, like a McDonald's fry, because you know all you gotta do is kind of put in your mouth and just roll it around and just kind of keep it moving. Yes,
any kind of French fry has too much grease in it. You know, a lot of research was done, for instance, on potatoes, and what they proved was you can eat as many potatoes as your body will hold, and you don't gain weight. But it's all of the grease and other material that you put in the potato, making the French fry, that has all of that extra energy in it and the fat, and that is put in the body and it becomes stored. The body can't use it at that time, so it stores it. And of course, what is fat? That's your stored material.
So it's not necessarily the actual potato. See, you are just clearing up so much for me, because I've always been told, well, don't eat too many potatoes, because potatoes get you big because it's starchy and it'll stick to you. It's not necessarily what we're eating, it's how it's being prepared.
Well, yes, that impacts what it does. And if you just boiled potatoes and you ate boiled potatoes, no, you would not gain weight.
I never knew that.
Yeah. Uh-huh.
And potatoes are a food that I really enjoy, but I've always been, kind of leery of it. So, yes. What about that person that says, well, I know that I should eat better, but what does that have to do with my mouth? And then it's like, well, I'm from a big boned family anyway. What could we say to those persons that's like, hey, you know what? Not only are you destroying your mouth, but you're destroying your body in whole. What about the quality of life? I mean, what could we stress to them?
We certainly would, and it doesn't matter whether you're big boney or not, and we're not saying that it's unhealthy to be large, but it's unhealthy to be overweight or fat. And some persons are genetically programmed to be thin, and some are genetically programmed to be large. But if you maintain the appropriate muscular portion of your body, whether you're large or small, you're in good shape. But where you get into trouble is when you get large, but that largeness is fat, it's extra fat put in there. And at that time, it starts to becoming unhealthy for you. And it taxes both the cardiovascular system as well as the neural system and everything else.
Well, Dr. Richardson, I must say that sitting here talking to you, I would not just in conversation realize that you were a dentist, because you are so knowledgeable about health in general, which is fabulous. So it makes me wonder, what role does my dentist play in my overall health, not just my oral health, but my oral health plus my just general health and my health in general? What role would my dentist play?
Well, the dentist can play a major role in your overall health, because the dentist has a pretty good background in terms of diet and nutrition, and the dentist is well aware of the fact that you should have certain kinds of exercise. And so the dentist can serve as a counselor to you in trying to supervise and maintain good general body health. The dentist can give you do your diet analysis because they are prepared to do it, or if they don't want to do the diet analysis themselves, then they would send you to a dietitian or someone who specializes in that area. But the dentist is very well qualified to do that. And it has been postulated that you can diagnose almost any condition by checking in the mouth and analyzing your saliva, and also analyzing your weight and etc. So the dentist is a very critical person in the maintenance of overall general health and well-being.
So what I'm hearing you say is, if I'm having issues with my gums, my dentist could probably tell me, you know what, you might want to go talk to your doctor, because there might be some other things going on with your heart. Or yes, looking at your mouth, you know what, I think that you might be having this problem with excessive weight gain because of. So the dentist could actually help be a preventive practitioner of other things happening just by looking at the overall condition of your mouth. Is that what you're saying?
Yeah, well, the dentist probably has a better chance to be a preventive healthcare provider than quite often the physician does, because generally the dentist works on persons that we think are well and healthy. And they see many of these conditions at the early stage, at a point wherein it can be prevented. And if it is something that the dentist does not ordinarily do, the dentist can refer you to the appropriate person to provide the preventive care or the curative care that is necessary in order to leave the person in a good state of well-being.
So what would you recommend to our viewing audience right now? Like, say, for instance, someone has a dentist appointment next week just for a routine cleaning and just checkup of the mouth. Is it certain questions that you could say, you know what, hey, you might want to ask your dentist this on your next visit? Is it anything that we could just ask our dentist to even begin the conversation of not only maintaining our oral health, but our general health?
Well, first thing I would say is make certain that you do go in to see a dentist at least once every 6 months or a year at most, and in order to get that oral examination. And you can raise any question to the dentist that you feel should be answered, and if the dentist does not, if it is a question about the general health of the person, if the dentist, if that is out of their area of practice, they will certainly send you to the proper person. And if there is anything that bothers you, you know, when they come into my office, one of the first things I ask them is, are you in good health? And if there's anything bothering you, tell the dentist. And the dentist, he or she, will certainly assess whatever problem you're talking about and decide whether it is something that he or she should treat or whether it's something that should be referred to some other clinician.
I have learned so much about my mouth tonight that I just never imagined or actually even thought of. So do you treat adults? Do you treat children? What is?
Well, I treat both children and adults. Obviously, you need to treat the children because, and children should come into a dental office early because the dentist needs to guide the teeth into the appropriate positions if that is possible. And the dentist needs to detect when the teeth are not coming in as they should so that if they need to help them, they can. And obviously we treat adults because, you know, we can move teeth. As long as the person is living and breathing, we can move the teeth.
You can move the teeth. And you know what, as you said that of course children need to be brought in early. I think a lot of times when adults don't go to the dentist,
yes,
it's because they didn't go often as a child, and so they grew up with this stigma.
Yes.
But now we have an issue as it relates to the economy and the recession and health care. Some families don't have the proper insurance to be able to afford to take themselves, or let alone their children, to the dentist. So how do you feel about the healthcare reform law and how it affects your oral health or just health in general?
Well, I think healthcare reform is the best thing that has come along in a long time. And it doesn't matter whether you call it healthcare reform or whether you call it the two Affordable Care Acts put by Congress, or whether you call it Obamacare. Healthcare reform is very much needed. The United States is the richest country in the history of mankind, and we have all kinds of resources, but yet when we look at the health status, this country ranks down about 14th or 15th among industrial nations. And you know, and the main reason we rank that low is because there's a large segment of us who can't get health care. Roughly about 1/4 of the population cannot receive health care. Health care reform will make health care available to everybody based on the American dream that everybody has a right to be able to follow their dreams. And everybody who is opposing health care, if you ask them, they have health care insurance. And they're trying to prevent persons who don't have health care insurance from getting it. And research shows that persons with health care insurance are more likely to get their annual physicals than the ones who don't. And that means that if they don't have the health care, then by the time they go in to see the health care provider, it's a very expensive curative process. If they have the health care insurance, then they go in and check it while it's still preventable. So I certainly endorse health care reform 100%.
You know, and I think United States is that exception, because a lot of countries, their government provides health care for their citizens, and this is not new, and it's amazing even to me that how people think this is a new issue, the government requiring its citizens to have health care. But a lot of countries, their government does provide health care. So I really appreciate you just kind of making mention to that topic. I just really appreciate this conversation, even just for my own personal well-being, because my dentist has oftentimes, every time I get into an examination chair, he asks me, has your health changed in any way? You know, has anything happened? But in my mind, I'm thinking he's just asking me that question just to manage the amount of maybe anesthesia he gives me, or I'm not thinking that, you know what, he's trying to help, you know, also play a role in my overall health. So this has been very enlightening for me as well. I know for our viewing audience, because we've always compartmentalized. Our dentist is our dentist, and our doctor is our doctor. Our dentist deals with our mouth, and that's it. And our doctor deals with the body, and that's it. Well, at least I haven't. I've never kind of intermarried the two, or kind of given them a role to play together. So I really appreciate this conversation.
Yes. Well, yes, you know, the dentist decided to specialize in the oral cavity, just as, you know, some physicians specialize in the eyes, the ophthalmologists, and there are persons who specialize in the throat, the otolaryngologists, and the ear. And then there are the persons who specialize, OBGYN, and, you know, the different areas. And by coincidence, the dentist decides to work on the oral and pharyngeal area. And, you know, that encompasses the mouth and the facial area and the neck. And we feel very, very competent in that area. And we have to be well aware of the rest of the body and fairly astute with it. And in many instances, probably we could treat it, but we feel it's not the area that we work on routinely, so we do refer the persons to the areas that they have routinely treated by someone else. Yes.
I really thank you for being my guest this evening, and it's been a wonderful information, a lot of information for me, I know. So Nashville, let me tell you now, you need to get to that dentist and talk about not only your oral health, but your health in general. And we want to thank Dr. Elijah R. Richardson for being our guest this evening to talk about your oral health and health in general. Thank you for tuning in this evening. Bye-bye.